Knock, 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 knock. Open the door a little bit. This is Pillow. May I come in? Thank you. My name is Richard. I'm a student nurse from Texas A&M Corpus Christi. I'm here to give you a postpartum assessment today. Would that be okay? Yes? Okay, thank you. I'll close the door for some privacy. I'll wash my hands, dry my hands, put on clean gloves. How you feeling today, Miss Pillow? You're doing okay? Are you in any pain today? No? Okay. Can I check your ID band? I'll check your identification bracelet, make sure that's my right patient. She gives me name and date of birth. Thank you, Miss Pillow. I'm going to start off by taking some vital signs, okay? I will move forward taking vital signs, which would be blood pressure, pulse, respiration. I'll check for temperature. Then I'll move on with my stethoscope, and I'll assess the patient's heart in our normal 5 key areas, and then I'll move forward with assessing the patient's lungs anteriorly, and then I'll have her sit up if she can and do it posteriorly. And what we're looking for is to see if they're bilateral and clear, of course, and of course what we're looking for the heart was to see if there's not any aberrations, use normal rhythm, good heartbeat. Oh, sorry. Well, while she's sitting up, I'll go ahead and move forward and check for CVA tenderness by palpating her back, and I'll ask her if she, do you feel any pain? Do you feel tender? She'll respond no. Okay, perfect. Then I'll go ahead and have her sit back. Okay, thank you, Miss Pillow. You may sit back now. Appreciate that. Then from there, what I want to do is I want to move forward and assess her bowel sounds. So I'm going to listen for her bowel sounds in the quadrants and make sure I hear nothing abnormal and just a regular, gurgling bowel sounds. Maybe she's hungry. I don't know. So then we'll do that, okay? Now I'm going to go ahead and start with my bubble he assessment. And what I'm going to do there is I'm going to check her breasts out, and what I'm looking for to see if they're soft, if they're firm. I'm looking for discoloration, like if there's like red spots or anything like that. I'll ask her, do you feel any pain in your breasts? I'll ask her how baby's doing. Is baby nursing okay? Are they latching on okay? Oh, excuse me. She'll be like, sure, everything's good. I don't have pain or anything. Baby feeds good. Baby eats loud. I'll be like, oh, okay, perfect. And then from there, what I want to look for is to make sure they're soft, so like normal breast tissue. And then from there, I'll move on to the uterus. So what I'll do is I'll tell her, say, hey, Miss Pillow, I'm gonna undo the coverage a little bit. I'm gonna palpate. I'm gonna check your uterus. I'm gonna palpate your uterus. And how I do that is I'm gonna find her umbilicus. I'm gonna go midline, and then with one hand, I'm gonna cup the bottom of her bladder area right here, and then with this hand I'm going to put it on her umbilicus, and I'm just going to press forward, and I'm going to feel for any kind of tenderness or anything like that. It should be nice and firm. And as I'm doing that, I'm also looking to see if I dislodge any clots or anything like that while I'm palpating. I'm looking for that too, and then if I do see clots, that's abnormal. So that's something I definitely want to make a note of. Okay. Thank you, Miss Pill. I'm just gonna put these back. I'm just gonna put this back. Okay. Appreciate that. Okay. So from there, I'm gonna move on to bowel and bladder. And like I mentioned before, I was listening to her bowel sounds. Everything sounded normal. I didn't hear anything out of the ordinary. Normal bowel sounds. And as the bladder, when I massaged the bladder, when I was checking the uterus, I noticed that it was empty because the bladder was midline. Now, if the bladder was up and to the right or something like that, then I know her bladder was full. Okay, but as I did it in this situation, the bladder was empty. Okay, and I can also ask her, "Are you going to the bathroom regularly?" She'll say, "Yes. I go regularly." And then I'll ask her, "Are you going into the hat? That way I can measure how much urine you're outputting." She'll say, "Yeah, yes I am." Then I'll make a note of that too, to go in there and do a measurement as well. Okay, so what do I want to do? That being said, then I'll move on to I'm not sure if I pronounce this right, locha, something like that. And as I was doing that assessment, that's another thing I was looking for too. Okay, it's just like when a woman's on her period, when she first starts, it's usually like a dark red color, and as it progresses, it gets lighter yellow, eventually gone. Right, the same thing here. So I was looking for that, and I want to make note of the color, the consistency, order if there's any, and the amount that I saw there. Okay, um, if they can, I'll have the patient turn when I'm doing this assessment. I say, go ahead and turn from me away from Miss Pillow. Miss Pillow would turn like this, right? Oh, it's gonna stay. Okay, yeah, perfect. Okay, from there, I'll notice the bed to see if there's any blood. Sometimes when you are doing the assessment this way, there may not be any presence of any blood or very little, but when the patient turns away from you, then you may notice that there was blood on the bed. So if there was, you want to make note of that, any clots, anything like that. Excuse me. While I'm back here, I want to check also for any hemorrhoids. I have a pin light here that I can check for hemorrhoids, but gently lifting up the buttocks, looking for hemorrhoids, and also the surgical incision, because she had a vaginal birth. She might have gotten an episiotomy, if I said that correct. And I want to look at the incision side and make sure there's nothing out of the ordinary. If they use sutures, all the sutures are intact. It's not inflamed. There's nothing coming out, any pus, anything like that. Any infections, stuff like that. Okay, thank you, Miss Bill. You may lay back. Perfect. Oh, excuse me. Okay, so from there, I'm going to check the Holman sign. And how I'm going to do that is I'm going to move down to the lower extremities here. I don't have any lower extremities here. And what I'm going to do is I'm going to check the calf for any tenderness. I'm going to check, as I'm doing that, I'm going to check for the heat, see if it gives off any abnormal heat or anything like that. I'm checking for pin edema. I'm going to be checking her reflexes. I'm going to flex her foot. I'm going to flex her leg. She has +2, good movement, stuff like that. Then I'm going to check for feet for clonus. Do it like this for clonus. Both. Do one leg, do the other. And then show my +2, everything looks good. We'll put it down, and we'll check this one, and we'll put it down. Okay. And I'll take care of my Holman sign. And then from there, I'm going to check her, just got to check her emotional status, which I kind of start by, when I came in, I say, hey, how are you doing today? She says, hey, I'm doing great. That was a giveaway. I could have asked her about, like, hey, how's your baby doing? What's your name of your baby? She goes, oh, he's doing good. I named him, I named him Billy. So, okay, cool. You had a little boy, stuff like that. We just kind of get a little rapport of them and see how they are emotionally. If they're very in tune to their baby, it stops becoming about them. It starts becoming about baby. Oh, how's my baby? Baby okay? Baby this, baby that. They forget about themselves. It's all about the kid. So, that's a good sign. That's what we're looking for. If patient was, very, very shy, very pulled away, can't look at the baby, doesn't want to talk about it, emotional stress like that, then that's something we make a note of. In this case, mother's great, baby's great, she's happy, her partner, dad, or father's happy with the baby. Everybody's doing well. So that's a good sign. Okay. I forgot something. During my assessment, I would have asked her if she had any any sweating. I understand maybe the AC was broken, but any abnormal perfusion. Going back to my initial vital signs when I was checking for temperature, I would check for discoloration. I would look at abdomen. To see maybe mothers get the stress marks, the linea nigra. I believe I said that, linea nigra. I'll look for that, discoloration. I'll look for redness, anything like that, or skin changes, because I do go through some skin changes. And then I'll talk about her diet. You know, before I leave, I'll take my gloves off. Everything's fine. You know, I just sit back. I'll talk to her for a minute. And I'll say, hey, you know, I think you're doing great. Baby's doing great. Just make sure you keep up with your diet. Make sure you have plenty of liquids. But you have plenty of liquids. It'll upkeep your milk for baby. You know, eat right, stuff like that. She may ask about her activities. She may say, can I go back to, you know, doing what I normally do? The answer is yes, but with some stipulations, which would mean I would tell her, like, yes, you can go back to normal. However, I would hold off on lifting anything heavy for a while, you know. And then it's just say more than 10 pounds. Like, I wouldn't, you know, lift a big old basket of laundry, or I wouldn't go cut the grass or anything. You know, I would just, you know, take it easy for a couple weeks, you know, be with baby. And then as it progresses, then she can do more and more and more. But initially, you know, you want to take it easy. She's got, you know, hopefully she has family, friends, her partner, people to help her out, do things as she recovers. Then once she recovers, then she can resume everything totally normal. But until then, no heavy lifting. You know, make sure you have plenty of liquids, eat right, take care of baby, stuff like that. I think that would include the assessment for the postpartum. So after I have that initial talk with her about diet and activity, stuff like that, I'll excuse myself from the room. Thank you, Mrs. Pillow. Do you have any questions or concerns for me? No, not at this time. Okay, well, if you do, if you change your mind, just make sure you ring your call light, and I'll come in. I'm happy to assist you in any way I can. Okay. All right. Well, I appreciate it, and I'll take off. Okay. So now I'll end my postpartum assessment. Thank you.